Should I abstain from sex or masturbating in hopes of making my testosterone higher? Is your testosterone tanking? The secret hormone crash nobody wants to talk about. And wait, does more sex actually raise your testosterone or kill it? Today, we're diving into the myths, the science, and the straight up shocking truths about testosterone. And here to help me is my friend and colleague, Dr. Mark Koenig.
Hey Jordan, how you doing today?
Great. Let's dive right in. What is testosterone?
So testosterone is one of the sex hormones that's present largely in men, but also in women. It has a number of different metabolic effects on the body. A lot of them are very positive. When you go through puberty, you're gaining muscle, you have energy. So testosterone is an important hormone for human development, but loss of testosterone is one of the predominant theories for aging in men.
So during puberty, what's happening with testosterone?
So when you enter puberty, your brain just starts cranking up and telling your body to produce more, which is a normal part of human development. And the effects are pretty exciting. You start having sexual function, erections. It can be scary, and unfortunately not enough people talk about puberty. But as we get older, then I think the testicles are just going downhill.
What is the big secret surrounding testosterone?
The big secret around testosterone is that it is a great hormone to make you feel good. Everyone knows that it helps you build muscle, have better sex drive, have better erectile function. A lot of people don't realize how critical it is in your sense of well-being. So it functions at multiple levels, and as it goes down, unfortunately, all of those positive things start to go away and become negative impacts as a loss of testosterone.
What the hell is andropause?
It's a great question. Think of andropause as the male version of menopause. It's where your testosterone is going down over time. Starting in your 30s, it just keeps going down and down, and you start developing symptoms of fatigue, depression. It's a miserable experience that very few doctors are educated on or talked about, but it's something every male is going to go through at some point, at some degree.
Men are starting to lose these functions slowly. Does anybody talk about it? I don't hear about it that much.
Unfortunately, there's a huge stigma attached to the effects of testosterone. Very few guys are comfortable talking about loss of sexual function, loss of erectile function. They may talk about having a little decreased energy or gaining weight. Depression is also very common in andropause, and a lot of guys don't want to talk about depression. So people aren't talking about it. Doctors aren't bringing it up because they're not educated on how to treat andropause, so they just say it's part of getting older.
Through puberty, our testosterone gets real high, but then there's a decline. Is there other specific reasons why it just declines slowly over time?
That's one of the predominant theories of aging. There's probably a dozen popular theories of aging, and that is one of the big ones is we age because our hormones are going down. Increasing or supplementing or augmenting your hormones can actually help diminish the effects of aging.
So I heard from some of my friends, they get like mood swings, lethargic, they're not thinking clearly. Is that part of this too?
It can be, absolutely. Testosterone is a feel-good hormone. It gives you a better sense of well-being, and I will talk to my patients and counsel all them. They will come back 3 to 6 months later and say, yeah, I'm building muscle and having better sex, but I just feel so much better. My sense of well-being is better. It's just I feel calmer, I'm less depressed. And I think that's really one of the understated, most important effects of testosterone.
So could this be a reason why men go through midlife crisis? What's your opinion?
I think absolutely. I think andropause is a huge contributor to midlife crisis. I mean, there's probably several things that contribute, and loss of vitality and competitiveness can drive guys to have an affair, buy a sports car, try to capture that kind of vigor and vitality they had when they were younger. Unfortunately, all they're doing is self-sabotage. They're destroying their relationship, they're wasting money on a car they don't need to be driving, and that can lead to greater depression and worsening problems.
How do you know if you have low testosterone?
First off, you should have a suspicion if you're in your mid to late 30s or older and you're having any of the symptoms we talked about. You should get evaluated, and then lab tests will confirm if you're low.
What if I get my lab test and it says I'm normal, but I still have those symptoms you just described?
Normal does not mean optimal. If you look at our normal population that these levels are based off of, we do not have a healthy population. We have a sedentary, overweight population. And so normal does not mean optimal. If your levels are 300, 400, 500, that is in the lower half of normal, and you can optimize that so you have a more optimal level, which means more optimal function, feeling better.
Before we jump into testosterone replacement therapy, are there habits or any natural ways to boost testosterone?
Absolutely. Number one, you should lose weight. Okay. And when I say lose weight, I mean lose fat, don't lose muscle. And go to the gym, start building muscle, improve your basal metabolic rate, stimulate release of human growth hormone, stimulate more production of testosterone. And then also just eat a clean diet.
What does clean diet mean?
So clean diet is really referring to finding foods that have the least amount of processing and the least amount of preservatives. I try to eat more of a whole foods diet. When we cook, we get meat, we get vegetables, we put together dinner. We try to avoid a lot of packaged processed foods because of all the toxins and chemicals involved.
And I've heard that they say like the men of now are having lower testosterone than like our grandfather and fathers.
That is absolutely true in my experience, and there's a lot of factors that go into that. There are toxins in our environment that weren't present when our fathers and grandfathers were growing up. And then we just have an increasingly sedentary society. They're eating processed foods, drinking too much soda, they're sitting on the couch all day.
That's the way to bring it up. What about like, what do we do that like tanks our testosterone?
Other than naturally aging, there's a lot of theories on that, and it's really environmental. It's the food you're eating, it's the toxins you're exposing you to, it's your inactivity, it's your weight gain. I have a theory that excessive porn can decrease your libido and your testosterone. So I'd avoid a lot of these things, moderate a lot of these things, and really work on your lifestyle comprehensively. There's a lot of theories about plastics and things that you should avoid, but in today's environment, society, it's like dodging raindrops.
Does testosterone affect our attraction or like confidence?
Absolutely. And just based on personal experience, I work in the ER, we work together. I have nurses who tell me on a regular basis that I am looking younger all the time because they saw me go through andropause. They saw the effects and they've seen me reverse the effects and get healthier.
We start testosterone. I always was worried if somebody starts testosterone to get more aggressive. Is that a thing?
Absolutely. If you're doing anabolic steroids, it can be a huge risk factor. Physiologic doses of testosterone do not have those negative side effects, acne, aggressive-ness, hair loss.
If I'm looking for like optimizing myself from like an athletic performance standpoint, could it be beneficial?
Absolutely. Pre-TRT, when I was in andropause, I was going to the gym 3 hours a day, just beating my head against the wall, making no progress, gaining fat, feeling terrible. Post-TRT, I'm crushing it at the gym. I feel good, I have great workouts, and I'm only working out an hour to an hour and a half a day because they're so much more efficient.
So we've had, people comment on videos before about like, should I abstain from sex or masturbating in hopes of making my testosterone higher? Is that a thing?
No. I would say absolutely not. Do not abstain from sex or masturbation. Your testosterone's not going to build up or get better because you're not using it. So use it. And personally, my theory is use it or lose it.
Got it. Could it go away?
So have fun.
Can low testosterone cause erectile dysfunction?
I think it can definitely contribute to erectile dysfunction. There are a lot of factors, your lifestyle, smoking, aging, but testosterone is one of the big contributors to erectile dysfunction. And if you improve your testosterone levels and secondarily estrogen levels, you can improve your erectile function.
I'm your patient and you're like, Jordan, we need to put you on TRT or I want to be. What are my options?
Okay, so TRT replacement, there's a myriad of options and adjunctive therapy. So everyone thinks that TRT is injectable testosterone, and it can be. There's different esters of testosterone that are available for injection subcutaneously or intramuscularly.
Okay.
A lot of patients don't realize they could also do creams, which means no needles, no pain if you have a needle phobia. They're easy to travel with, so I have a lot of flight attendants who just don't feel like taking injectables on their flights.
Right.
So they use creams and they can be applied and be very effective. There's also pellets. I'm not a fan of pellet therapy personally because some of the potential downsides, but it's available at some clinics if you want something that's very low maintenance.
What are some of the adverse effects of testosterone? I think some people are worried that they might turn into the Hulk.
So there are a couple side effects that I counsel all my patients on. You're going to notice the good effects with some hair gain. The number one is if you have underlying sleep apnea, we know testosterone can exacerbate sleep apnea.
Okay. So if that makes my sleep apnea worse, I don't have, what would I do?
Monitor your sleep apnea as you're starting testosterone therapy. And if you're getting increased apneic episodes, that is very concerning. However, if you look long term, most of my patients are losing weight consistently, which is one of the big risk factors factors for sleep apnea. So over time, they could actually have improvement in sleep apnea. One of the big conversations I have with my patients are my younger patients who could still be within childbearing age. And I tell them there's a theoretical risk of infertility. As you take testosterone, you could suppress your testicular function, which means less sperm, less quality of sperm. So that's something you really need to consider before you start TRT. I don't know of anything else that has come up in my training that are adverse effects of properly used physiologic doses.
What about prostate cancer?
So that's a great question, and it's fairly complex, but I've gone to conferences with thousands of participants with world-class urologists, and they all talk about the saturation model of prostate cancer. So the theory or the understanding is once your levels are at 100, you have maximized your risk for prostate cancer. So whether you're 100 or 1,000, you do not have additional risk of prostate cancer. Okay?
Yeah. Do you think moving forward in the future that there'll ever be a safe over-the-counter testosterone vitamin?
So testosterone is a controlled substance. So yes, we may get oral testosterones in the future based on the way things are going, but I don't think there's ever going to be a vitamin or supplement that completely augments or supports your testosterone levels to more youthful levels other than actually replacing that hormone.
A worry for a lot of people is once you start testosterone therapy, are you on it forever?
I tell my patients, you go to the gym. Are you gonna go to the gym for 3 months and get in shape and then quit? No, I'm committed to the gym for the rest of my life. You can stop testosterone therapy anytime you want. The problem is you're gonna go back to feeling crappy and andropausal, and you may actually have advanced due to aging since you started TRT, so you may even feel worse than when you started.
Wow. So if you are thinking, this is me, these are my symptoms, I'm so aligned with what he's saying, Dr. Koenig actually has a practice aligned with helping with hormone health.
If you're having any symptoms and you're in your mid-30s or beyond, you could reach out to me at Optimal Health, or you could find another provider in your area.
If you enjoyed this video, definitely binge watch this entire playlist right here, and please make sure that you hit the subscribe button, turn those bell notifications on, and hit that like button for me. Thank you so much for watching.
And stay healthy, friends.